cancer is called oncology. Cancers have been known to mankind since ancient times. Although the word cancer was not used, the oldest description of the disease is from Egypt and dates from around 3000 years before Christ. Cancer is a disease in which cells in the body begin to multiply uncontrollably. Lung cancer is cancer that forms in tissues of the lung, usually in the cells that line the air passages. It is the main cause of death from cancer in both men and women, since it is silent and when you get to the doctor it is already in a very advanced stage. There are two main types, small cell lung cancer and non-small cell lung cancer. These two types grow differently and are treated differently. Non-small cell lung cancer is the most common type. First, we are going to talk about small cell lung cancer, which represents 40% of all lung cancers. This type of cancer tends to be aggressive. Cancer commonly grows rapidly and spreads to other regions including the lymph nodes, bones, brain, adrenal glands, and liver. The risk of developing this type of cancer is highly associated with smoking. Now, we are going to talk about non-small cell lung cancer. This type of cancer is divided into three categories based on the appearance and other characteristics of the cancer cells. Squamous cell carcinoma represents approximately 25 to 30% of all lung cancer cases. It is highly associated with cigarette smoking and normally develops in the central region of the lungs. Adenocarcinoma represents approximately 40% of all lung cancer cases. This type of cancer usually develops in the outer region of the lungs. Lung cell carcinoma represents approximately 10 to 15% of all lung cancer cases. It is associated with rapid tumor growth and worse prognosis. By 2020, the American Cancer Society calculates for lung cancer will be diagnosed about 2028 820 new cases of lung cancer. About 1,035 720 people will die from lung cancer. Lung cancer is mainly occurs in the elderly. The majority of people diagnosed with lung cancer are 60 years or older. A very small number of people diagnosed are under 45 years of age. The average age of people at the time of diagnosis is approximately 70 years.
Lung cancer is treated in several ways, depending on the type of lung cancer and how far it has spread. People with non-small cell lung cancer can be treated with surgery, chemotherapy, radiation therapy, target therapy, or a combination of these. People with small cell lung cancer are usually treated with radiation therapy and chemotherapy. The surgery is an operation where doctors cut out cancer tissue. Chemotherapy uses special medicine to shrink or kill the cancer. The drugs can be pills you take or medicines given in your veins or sometimes both. Radiation therapy uses high energy rays, similar to X-rays, to kill the cancer. And target therapy uses drugs to block the growth and spread of cancer cells. The drugs can be pills or medicines given in your veins. Doctors from different specialties often work together to treat lung cancer. Pulmonologists are doctors who are experts of diseases in the lungs. Surgeons are doctors who perform operations. Thoracic surgeons specialize in chest, heart, and lung surgery, and medical oncologists are doctors who treat cancer with medicines. And radiation and oncologists are doctors who treat cancers with radiation. Choosing the treatment that is right for you may be hard. For that, you need to talk to your cancer doctor about the treatment options available for your type and stage of cancer. Your doctor can explain the risks and benefits of each treatment and their side effects. Side effects are how your body reacts to drugs or other treatments. And for lung cancer, there's no psychological treatment.
Most lung cancers do not cause any symptoms until they have spread, but some people with early lung cancer do have symptoms. If you go to your doctor when you first notice symptoms, your cancer might be diagnosed at an earlier stage when treatment is more likely to be effective. Most of these symptoms are more likely to be caused by something other than lung cancer. Still, if you have any of these problems, it's important to see your doctor right away so the cause can be found and treated if needed. The most common symptoms of lung cancer are a cough that does not go away or gets worse, coughing up blood or rust-colored sputum, chest pain that is often worse with deep breathing, coughing, or laughing, hoarseness, loss of appetite, unexplained weight of loss, shortness of breath, feeling tired or weak, infections such as bronchitis and pneumonia, new onset of wheezing, bone pain, nervousness system changes such as headache, weakness, or numbness of an arm or a leg, and yellowing of the skin and eyes.